We're going to call the order of the meeting. It is, let's see, 6:33 on, today's June 10th. We don't need a roll call, do we? No.
You should, because of the audio.
Oh, okay. Can I have a roll call, please? Or,
Cindy Gaffney.
okay, yeah.
Melissa Yax.
Lou Ortiz.
Sarah Clark.
Cecilia Carmen.
And Joe Clark.
You guys want to say your names, do you? No. Okay, all right. All right, any public participation?
What's going on back?
Let's see, any public participation?
Public participation, is that one?
No? Okay, hearing none, we'll move on. Approval of the, yes, what?
Before we go to approval of minutes.
Yes.
On behalf of the board, I'm grateful that you've all accepted the assignment to this committee, and I wish you well. Some things that you should consider as you establish. I'm here for the purpose of seeing if the committee gets up and running, and you're the chairperson. You should,
Yes.
because when you go into an executive session, you need somebody to record from the committee. So you should see if any of the committee members will volunteer to be the committee secretary
Okay.
and identify that.
Oh, should we do that now?
Yep.
Would anyone like to be the secretary? Okay, everyone's ready. Okay, it's all right. This is executive minutes. They talked about this issue. The end. It's really, it's very vague, if anyone wants.
Can I temporarily try? If I do it wrong,
Oh, sure, thank
fire
you.
me.
Yeah.
And in regards to any rules that you want to have for your committee, you can go ahead and set those up now or at any other time.
I believe we should have food here.
Okay.
I make a motion that we should have food at our meeting.
Then you want Kyle on your.
Exactly, okay. As long as,
That's all I've got.
okay, all righty, well.
So do I write like, Mr. Clark, update everyone?
No.
No, it's just for
Only
executive session.
Executive
Just for
session.
executive session.
Oh.
Yeah.
Not to do anything when everyone's
No, no. And it's only when we have it, like,
Great,
yeah,
so great.
So nothing tonight.
yeah. So
I had a pen you could borrow.
We have minutes to approve.
we just have minutes to approve. So you'll be like, these people are in the meeting, minutes, discussed minutes from August 3rd. And then
Who says who?
Yeah, and then, because we can't approve it in the minutes, right? We can't approve, or can we? I'm always confused. You can't approve an executive session in the minutes. And then we talk about.
We review them in executive session and give a
come out
thumbs
and-
up to
Okay.
approve them in open session.
Yeah, so that's all you're gonna say, approved. We reviewed executive, reviewed
But not
minutes.
now.
No.
And these are the past ones,
No, no, okay, all righty. Okay,
All right, we're done.
all right, so we're not approving that, so there's approval of the minutes, but we're not doing it until executive session.
No, that's a,
These are regular minutes.
Oh, okay, all right, do I have a motion to approve the minutes from August 3rd?
who made the motion the last time?
Oh,
I do, I make a motion.
okay, do I have, okay, Cindy is making a motion, do I have a second?
I'll second it.
Okay, great, Sarah, second it, all in favor?
Aye.
Okay, minutes approved. All right, new and unfinished business.
Okay.
All right, food pantries.
Food pantries. So this has been, I would say a super hot topic, but it has come up a couple of times at the county board. And I do want to introduce Tracy Von Bergen from the county board, who chairs the Public Health and Community Services Committee. So we were asked to go to the last Public Health and Community Services Committee to talk about our fees specific to food pantries. And we're going to talk a little bit more later with regard to the ordinances, like the schedule. However, we wanted to invite Tracy here, and she accepted, just to maybe go over about the request that the county board made of us, or the Public Health and Community Services made to us. Patty and I were at the last meeting. Patty presented to the committee, answered all their questions about how we set our fees, And then there were a lot of questions about food pantries, and the request was to waive the fees for the food pantries. So that has implications long-term for the public health ordinance, but we did waive those fees. I have the ability to do that for those food pantries this year. Did I touch on most of that?
Yes, yes. So I had personally had a few people that run food pantries reach out about the fees. They had not been assessed in the past, and really it's the smaller food pantries that really kind of struggle with it. They don't have a lot of funds. They're at this point now purchasing food for a lot of their clients. And so myself, as well as another board member, did bring it up, and as chair of public health, I felt that it was important to bring it forward and see what we can do. And thank you, Patty, for all of your information. There really were a lot of very good questions, but we felt that, you know, as a county, well, as a committee, there was a general consensus that, you know, we would like to move forward with waiving those fees, basically at the risk 1 level. I think there's one food pantry, if not more, that do other services that they get a higher risk level permit. But we just wanted to look at the risk 1 level for that. And, you know, these food pantries serve our most vulnerable people in the county, and we would just like to see that move forward in ordinance form.
So are there any questions? Patty did a thorough review of other food pantries in the other counties and kind of did a side-by-side comparison on who waives the fees, who doesn't waive the fees. Many of them do. In many cases, their fees in general are much higher than what we charge in McHenry County. We feel they're very reasonable. I think the total cost of to waive all the fees was, correct, 3,000, under 3,000?
It's under 3,000.
Do we have this somewhere? To look at, like, what are the fees for, what?
Oh, they're oh, sorry, go ahead, Patty.
Pays them, like, am I
So we have
missing-
to
am I
do
missing-
food inspections. So they're a food establishment. They're considered a food establishment for the purposes of doing a food inspection, and it's based on risk category and size is how we base our fees.
Okay.
So we still have to do the inspection of those facilities, and that's where I think Tracy was saying that the Illinois Food Bank, for example, had given us a list of all the food pantries. So we had some already that we were inspecting. They gave us a list to see if we had everybody covered. Okay, and so through that process, when Tracy said that some people hadn't been charged before, we didn't know that they were a food pantry, or maybe they've come online, you know, more recently. So that is how this process started, and I think that's how some of the questions came forward, is people were like, why am I getting, you know, charged for this? But we consider them a food establishment for the purpose of inspecting their, how they handle the food.
So what is level 1? Right, so every food establishment is given a risk classification based on the complexity of the food handling and or the population that they serve. So actually, it's reversed. So they're by ordinance at category 3. So essentially a low risk establishment. So what Tracy has described is really the food pantries that are like flow through for food. So they receive their food from an approved source. It comes in the package as it is. They do temperature control, et cetera, and then they forward it on to the, you know, to the needy families, right? So it is a low risk establishment. And so as we were putting all of them, getting them into the permitting process, the fee was, for almost all of them, $175. So that's a low-risk institution. That's the category we felt they best fit. And so, in looking at this, as Melissa said, it's under, $3,000 total for that. So what I have done is I have proposed an ordinance change. And as you know, we're looking at revising the ordinances, all of them, as we look at them annually. And so I'm proposing to define what a food pantry is, and that's based on the discussion we had at Public Health and Community Services. So basically, low risk, provides food specifically to needy families and at no cost to the families. So that would be the definition, and I really used something out of the Department of Agriculture. So I think it's fairly consistent with how food pantries are viewed. And then what I'm proposing is in the fee schedule, we have an area that allows us, that addresses things like waivers of fees and things like that. So then those establishments would be subject to ordinance requirements and inspection, but they would specifically be exempt from the fees. And so that's what I'm proposing in those ordinances that I gave you.
Okay.
Does that help?
And those are redlined in the packet.
Right.
Yeah.
The proposed, okay,
Yes.
language changes.
Yeah.
So, question just for my brain, is pet food, if pet food's distributed in a food pantry, what?
Yes.
Yes, we do not regulate pet food, Department of Agriculture, so we don't have any involvement with the pet food.
Right, but are they doing pet food and people food at the same place?
That I'm not aware of. I've not done any of the inspections myself, and I'm not aware that.
I know Lake in the Hills does.
I'm gonna guess no.
Okay.
The only reason I ask is because storage of pet food is really a higher risk with rodents and insects and things like that.
Sure. So as I said, though, they'll be subject to the inspection, so we're gonna look at all those things just as we would in the Jewel or any other, food store that we look at. So they'd still meet all those requirements. It would just be strictly a waiver of.
Yeah, I know Lake in the Hills has pet food, but I wouldn't worry about, it goes so quickly. The day it's there, it's gone. So it never stays. It's one of the things that never stays, so that won't be a problem.
I'll step in and I know my non-for-profit is an establishment. And like you said, it's because Northern Illinois Food Bank. We're not a food pantry, but they deliver the food to us and we distribute that food. In the school year, it's snacks, so they deliver weekly. During the summer hours, they deliver daily, and maybe there's some left over that we could use the next day, but they're refrigerated. But normally by the end of that week, all of them are gone. Are we talking about those sites and food pantries? Do we have a number of how many we have in our county?
For the food pantries, the list that we were given from the food bank is approximately, it's 20 to 22. Now, a few of those actually operate out of already a permanent food establishment, so really not an issue for them. They're covered under that umbrella permit. So yes, we've had involvement with establishments like yours in the past in terms of summer food programs, et cetera. So the key is when you hand out snacks and prepackaged, et cetera. Did you mean to jump in? I'm sorry.
Go, keep talking,
Okay.
keep talking.
Okay. Not a problem. It's when you get into temperature-controlled foods. That's what triggers, that we are involved with those and things like that. And or where you start to open packages, repackage foods and or serve foods, then we're also involved in those.
Yeah, I could see that, but I think that with Northern Illinois Food Bank and the county, there is kind of, because we've been you're risk 1 or you're risk 2, and it's not really sure what risk we are. It's always a confusion of what food do you guys provide? And we're not preparing any food, it's just packaged food.
Right.
But Northern Illinois Food Bank requires us to have a county.
Exactly.
So
That's the, just so you get it, that's the issue, is Northern Illinois has to meet standards for the state. And part of those standards are to notify the counties that they're working in who they're exchanging food with. The categories is all up to the county, and it might be different in each county depending upon what their ordinances are. But that's how, again, the whole thing came up, because some people who were not being identified by the county as food establishments, not pantries, establishments, were caught after Northern Illinois provided the list to the county.
Okay.
Following that, bang, bang, bang. So many of those food pantries then came forward and said, you know, you're gonna charge us $175 when we're using all the money to buy food for people who are, you know, in food deserts or are having food poverty. And so, just in discussion at the board level and then under Tracy at the committee level, it was kind of indicated by all the board members that that is an area that they would like, particularly as it's under $3,000 and we can absorb the cost of inspection. So that just, and we're here just to kind of give you that little bit of background. So the communication between board direction and Board of Public Health, we have a better understanding and you can ask questions.
And I could say that we've had an establishment for, I want to say 6+ years now with Northern Illinois Food Bank. But when you look at Northern Illinois Food Bank, at least for the summer sites, not food not food pantries, because I know they bring in their big trucks to church sites, not including those, McHenry County is always like really low on sites. And I'm like, why? Like, why are we so I know McHenry Public Library is one, and we're the only other, those two are the only ones in McHenry. And then at like one in Crystal Lake, and I'm like, this is a food-free service, that Northern Illinois Food Bank. But when I share with my community partners, non-for-profits, it is a struggle to kind of go through it. We've done it and we do it because we've done it for the last 6 years. But if you're new, it's hard as a smaller non-for-profit. You got to get your area established. When we got a new location, we got to go in through a new application. So it's not easy. Like, I think that's preventing people from having these summer free sites, lunch programs, because you have to go through all of these different things, ordinance with the state, because Northern Illinois Food Bank gets funded through the state and then the county. And so, I know, they've been awesome with us where we have questions and we're like constantly being like, do we have to follow this? Do we do this? Do we do that? Yeah, technically you're an establishment, you do, but we're just doing snacks. But we have to get our food handling management certification and all of these things. We have to pay for that. Luckily, that's a 4-year certificate, but if you have a turnover, constant turnover in a not-for-profit, those costs could add up. And that's what could prevent people from partnering with Northern Illinois Food Bank, and could prevent Northern Illinois Food Bank to serve our county because of all of the steps that we need to go through the state of Illinois.
My intent is not to get stuck in the weeds here. I'm just trying to understand. So, so we're removing fees for food pantries who are giving people food who need food, but we're having other non-for-profits pay fees and they're feeding kids food who don't have resources. So is there like a line somewhere?
Well, I would say that was one of the discussion points in the committee. Yes.
Because we talked about a slippery slope.
Right.
Yeah.
Right.
I give all I have to YFC. These kids need it. Like, so food pantries need food more than these kids need food. I don't.
Or the way I would advocate is if providing food was our only service, of course we would invest in it. But when providing food is not our only service, we still invest in it because that's our only way of getting these lunches to our youth. So we're following county guidelines and state guidelines. We end up doing it, but if that's not our only service, right? So I think establishments that is their only service, or I would want it to be kind of fair across the board.
I think you guys can have that conversation amongst yourselves when you're doing the ordinance. Our issue is the food pantries because that was brought to our attention. And so we specifically wanted to address that. If you want to have a conversation and talk about other items, the only difference I see is the food pantry we talked about, because they're not serving food to be consumed on site. They're packaged food out the door, off the shelf, out the door. They're not preparing, they're not consuming it on site. A little bit different than perhaps, what you guys, I don't know.
Yeah.
You guys have had to have that conversation.
So that's how we defined it then in the ordinance, as really that pass-through establishment, you know what I mean, like that. So I do understand exactly what you're saying, and that's probably a part of a larger discussion, because when we looked at the fees and what we do and what counties do, historically, we have charged just a fee for the service that we provide. You know what I mean? So over the whole categories that we do, whether you're category 1, 2, or 3, then the size of the establishment is what was factored in. As we have a fairly complex, food permit schedule, actually more complex than most because of that. It's intended to reflect the cost of the service. In general, is all I'm saying.
My last question is the money that is accrued through those fees, where does that go? And will that be a loss to like the employees who are doing the inspection? Like where does that $3,000?
Well, it just gets
Yeah, so
absorbed,
Where does
basically.
that
yes.
go?
Yeah, this
Into the
stuff
general fund?
into the general fund.
Of the county.
And how big is that general fund?
I don't know, we never
The
gave
total
you
just
one.
for the.
I'm trying to give Melissa an idea, the $3,000 out of the general fund is.
Oh, is out of the total county
It's
general
nothing.
fund is.
Oh, well, remember that next time we want
I didn't know if it was like coming from like employee salary.
No, but the total.
It was a good question. I was just trying to put it in perspective, that it's nothing, it's immaterial. A town would wipe it off.
Okay.
Just
Sorry,
a
Patty.
different question, just for my edification. Is a food pantry defined as refrigerated and packaged, or is it just packaged, non-refrigerated? I mean, are pantries storing product or taking in product that need to be refrigerated and stored?
Correct, and it's that temperature control of the food that actually requires that they have the permit. So if you had a food pantry, or if you were doing, we've had this conversation actually before too. So if you were limiting what you're providing to foods that do not require temperature control, and they are all prepackaged, it's just not a food establishment by definition.
Got it, okay.
And so that is that
Got it.
trigger.
And so church sites who partner with Northern Illinois Food Bank, like let's say one day out of the week, that they're bringing in their mass truck to do the distribution, that would be considered a food pantry.
Yes, I would tell you, we do not have any of those on our list. I know.
Then you did not hear anything
No, no,
from
no,
me.
no, 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 no.
Just talking about examples.
Right.
Right. Well, there was one like Kane County, they had that Fishes,
Fishes and loaves.
yeah, where it's like a mobile food pantry, but I think that's all.
Like mobile food pantries, and I think
I think
Northern
those are
Illinois
all
Food Bank stays there.
non-perishable.
Like Northern Illinois Food Bank is stationed there. So I'm assuming that would be under their,
State license.
yes.
But if it's all non-perishables, then it doesn't matter.
If there are foods that don't require temperature control, that's one thing. If they bring the refrigerated truck, and that part of the process is that they're providing proteins and other things like that that require temperature control, then theoretically they are subject to the same type of regular. I'm just telling you that I do not have any of those to my knowledge on our list.
Okay, yeah, I think that this is where the slippery slope could be, because I could see why food pantries that are now being charged, and if there are some, I don't know if there is, but if there were some out in the county, then I could see why food pantries like, whoa, we're paying for this, but there's others that might not be. And what I think at the point is like distribution should be, we should, not-for-profits or entities that want to provide that distribution should be able to, without having to,
Right, so obviously we fully support that in providing food to people who need food. And I think though that, I just don't want us to lose the perspective that, at the national level, they're defined as food establishments. And that goes back to 2017 when the state of Illinois adopted the national standard for that. And that's where the definition came in, because prior to that, very few were permitted. They just weren't. And so it's part of that process. And I think just from the public health standpoint though, controlling temperatures of food and ensuring that the people that are downstream from it receive foods that are just as safe as if you went to the restaurant and bought them is just a very important thing.
Yeah.
So I do understand the concerns. I just kind of have to advocate a little bit for the public health part because it is why we're involved,
Right, yeah.
So I'd like to make a motion to adopt the changes as we.
Where in the schedule of fees does food pantry, excuse me,
Oh, it's
fall
under,
in?
It's a miscellaneous food program, no?
no, we're.
Oh, that's construction.
I think they got other, maybe out of order.
Well, this is the comment that you're asking to insert under the general notes.
It's under institution.
Okay.
So I put it in the section, Joe, you're right, in the general environmental health fees, in the fee schedule, that talks about when fees are waived or modified or reduced. So that's the red line.
The classification doesn't, you wouldn't know food pantries are, it's nursing homes, hospitals, other institutions is where we currently have food pantries.
Right.
But it's not called out as its own
Okay.
distinct.
All right, so it'd be other institutions would cover food pantries.
Yeah.
And risk classification, 3 is the lowest risk.
That's,
And it's, but there's no further definition of it. Like for some of them, it says, so many seats for the restaurant, et cetera.
and with the institutions, we do not do that. It includes like nursing homes and things like that, where it's really based on the kitchen and the facility as opposed to number of seats like in a food restaurant or bar.
Okay.
That's right.
So we're proposing to put a definition into Article 1 and have this caveat added under the section where we have the ability to waive fees.
In Article 7.
Correct. Okay, so I have both of those.
So I think really what we're looking for is if this is the direction to move forward, because then we'll incorporate it into the ordinance standards as we bring it forward through the regular process.
And then I'll come back.
It will absolutely come back.
Yep, it's gotta
to
go
this
out.
group and to the board and to the council.
So we don't need to vote on it.
Does everybody understand what the fee, the $175 fee is for?
Yeah.
What's it for?
For the inspection.
For the inspector to come out
Yeah.
and inspect. It's to offset the costs
Right,
for having the inspector come do that job. And under the current scenario, it's a user fee. If you waive it, the expense is still there. It's just now, instead of being a user fee to that one pantry, the expense is distributed amongst the general population,
Right.
which is reasonable.
Yeah. All right, so do we need to vote on this now, or no?
I think if we just have general consensus on how to
Okay.
move forward, we just wanted to give you some example language of what we were thinking about to incorporate.
Is there anything that they can do to mitigate the time that you spend doing it? Other like pre-filling out forms online and that kind of stuff, or you just go on?
No, not really, but what we built into the process is that these are fairly straightforward. And in addition to the inspection, it also includes obviously re-inspections that we would have to do or office time, et cetera. And so there's a limited amount with this because of the limited type of operation they have. So
If you were comparing it to a regular food establishment, like a restaurant,
yes,
time,
less, a third. Or less, depending on size, complexity.
thank you.
Ballpark there.
All right, next on the agenda is open air dining and outdoor bar policies.
You want me to just kick it over to you?
Sure.
Okay.
Do you need like a breath?
No.
Did we change those since COVID?
So these were put in place, one in 2011 for outdoor bars, and then the open air dining was 2017. So yeah, it was
Prior to COVID. Thank you.
Thank you. Oh,
Bye,
good
thank you.
night.
So we put these in place, just to have a standard and to try to address consistently, how to handle these facilities, because we have over 1,500 of them, right? And so we want to be doing the same thing for every single one. Fairly conservative. So there are two different situations here. One is open air dining, and with that allows establishment operators to open up the facility, right? So, people really do like it. It's, open up the big doors or the big windows or whatever it is. So the risk with that we're trying to mitigate is you open it up and then you can invite, things into the establishment. And so our concern really would be primarily vectors, rodents, insects, things like that can then, transfer disease through food. So that's
We
what
didn't
this.
knock on the door to get in the regular way.
Right, they tend to do their own thing. And then
Don't turn away at the back door.
Yes, and then the outdoor bars, which has been in place for a long time, and there are a lot of them, but it was really to try to keep it simple. And it's a little bit different because we're not inviting those into the establishment, but they can certainly affect, the food handling, the providing drinks, et cetera, primarily insects, not typically rodents. So really what we're trying to do with this is just try to open up a little bit more flexibility for the operators, and it's primarily in what can be done at the bar itself. And so this really comes from a food establishment operator that wanted to do more at that. And we did look at it, and a variance was granted, and we wanted to look at it for everyone, to provide everyone the same opportunity. So what I'm proposing in this is to allow bar sanitizing of dishes, et cetera, glassware essentially, to be able to happen in those situations. So initially we tried to keep it very limited, and not have that going on when everything is open and you're outside. I would tell you that I don't think it'll be a problem. We haven't seen a lot of problems with facilities with the open doors and things like that. They've done fairly well. We have enforced it consistently, which is, I think, a good thing. So that's really essentially what we're proposing, is to allow glassware and things to be washed, either at an outdoor bar or when open air dining is taking place. And I think it would be okay. I would tell you at the outdoor bars and stuff, almost all of them use disposable. They really, very few.
I thought we had that as part of the ordinance, or not?
We did have it, not as an ordinance,
Part of
but
the
as our policy. And I don't expect that to change, because there's a lot of work that goes with, glassware and stuff like that. But we've had at least one that really the business model was slightly different. And so if it's not a risk there, we want to address it across. That's what we're trying to address there. Does that?
And we want to
Context?
incorporate these changes into the ordinance.
Yes, I would, yes. Melissa and I have talked about it. We would recommend that it be incorporated into the ordinance as really regulation. It would eliminate that there be a variance. If you meet the standard, you would do it. It would allow us to enforce it that way, simplify the process for the operators, and it's clear to everybody. That is what our suggestion is. Because currently they're policies, but I don't see why we couldn't just incorporate them as an option.
Yeah, I don't see any problem with that.
Yeah.
So in the short term, do we want them to approve the policy until we get them incorporated into the ordinance?
That would be wonderful.
I make a motion that we approve the policy as amended.
Okay.
Do I have a second?
I'll second it.
Is there a second? Now I forgot.
Any further discussion?
Any further discussion? Thank you. Okay, do I have, what is that? Everyone,
Motion passes?
Roll call vote?
roll call vote, wait, yeah. I was in my train of thought.
Ms. Gaffney?
Yes.
Very quiet.
Ms. Clark?
Yes.
Ms. Carmen?
Yes.
Ms. Ortiz?
Yes.
Dr. Katz?
Yes.
And Mr. Clark?
I don't vote.
It is a vote.
Okay. Thank you.
Okay, yes, okay. Next, Board of Health bylaws. Dun, dun, dun.
Well presented.
Okay, so,
Yeah, thanks, Patty.
two things. The first, we need to update the bylaws to include remote participation. During the pandemic, during a state of emergency that allows for that, we do have to have a quorum in the room to allow someone to participate remotely. So we just need to clean up the language or add some additional language into the bylaws to allow for that to happen. But it doesn't, I don't think it specifically says that you have to have a quorum. I think we just need to add, shall we constitute?
Let's see.
I'm
So
scrolling.
had we already added it? I didn't think that we had it in here.
I thought they could participate as long as there was somebody here and voted in, right? Is that what you're talking about?
Is this your proposed language that just didn't get
It didn't get red line.
underlined, red letter underlined, or is
Or
this
did we
existing?
already, It should be existing
I'm
unless
looking for,
we add.
I didn't see any red line on mine.
No, well, we didn't, no, so, well, that may be my mistake. I didn't think we had.
let's see, what line is it?
What I'm pointing out is
We're on page
Under-
5.
Yeah, but which one is it?
C and D.
Oh, C and D, okay.
I just read it.
Okay, board member attending a meeting cannot be considered present versus quorum, if a quorum is.
No, this is right, because this comes straight out of the, these are the reasons that are allowable. Well, that's my mistake, because for
Okay.
some reason, I had it on my list of things to. All right, well.
Right,
Okay.
yeah. They can attend the meeting, but they just can't be considered part of the quorum.
Yes, they have to be voted in,
And then they're part of the quorum.
and then they're part of the meeting. But they cannot attend remotely for executive session.
Correct.
Correct, yeah.
So that if we had an executive session, they would need to be.
Yes, they would have to leave the meeting. So, but you still have to have a quorum in the room to continue
To
the
begin
meeting.
meeting,
Exactly, to be meeting in the first place.
And I believe also, if they're attending remotely, every motion has to be a roll call vote. You can't do voice votes because they can't record the voice vote. I believe I'm correct on that.
Well, the board can add that language.
That would be-
What was it, what were you trying to
Well,
say?
I mean, I don't know, I think
If
it's.
we're all here having a meeting
Yeah.
and Sarah's here on the television. And the issue comes to a vote, you can't do a voice vote, even if it's a non-monetary issue, because you have somebody remotely voting. So you have to do a roll call vote, even though it's a non-monetary trivial issue.
But if you can hear her,
Because that way you can record what the person says, and identify the person remotely. I believe that might have just.
but don't we do that already anyway, right?
Yeah, I think we,
Yeah.
but I was just calling that to the attention. I know we had to do that during COVID. Every vote had to be a roll call vote because we were doing things via the internet,
Right.
via telecommunications.
Yeah, I don't know if, I was thinking of when I was on the village board, and if someone was remotely, we had adjourned, it was always just all in favor, so.
And, do you have any experience with this?
I don't,
Well, monetary has to be voice vote.
right,
Right,
but for
but-
non-monetary, I'm thinking.
Non-monetary, and the reason they started doing voice votes, and I don't know if it's in a law or ordinance, so, but because people were calling in to meetings, they couldn't see who was voting yes or no. People might not be able to hear them, so you had to very much articulate your vote of yes and no. And so people just started going to voice votes on anything on that.
We don't have anything that specifies around video, that members need to.
Okay.
I mean, in some cases, I suppose somebody could
The chair can always
be on a
call,
phone
can
and
always call
not.
for a roll call vote. So I mean, that can be the solution too.
Yeah,
If you have somebody remotely,
yeah, I
and
get
you
you.
need that person's vote recorded,
Yeah, just
Do a
do a
roll
roll
call
call
vote.
instead of all in favor,
Correct.
okay.
I mean, I think that's fine, I'm not gonna remotely be at the beach or something, the reason, I'm just thinking, why would I ever be remote?
Well,
And it would,
the purpose is already.
Yeah,
it has nothing to do with where you're at. It has to do with recording your vote.
sure, but I would be people would be paying attention and able to say yes,
Or able to show their face.
right.
yeah. It would be my kid has strep throat and I don't wanna give it to everyone,
Right.
so can I listen and be involved
Yeah.
from far away?
Yeah.
Yeah, that's perfect, it's a perfect reason.
Actually what's happening, but, anywho. But so I don't think is it a big deal to do a roll call vote every time?
No, there's only a few of us,
Okay.
no. Unless Cheyenne gets really tired of saying all our names. It's either. She's like, done. Okay, so executive session, we don't need
Well,
it.
we still have one more item under the Constitution and bylaws.
Oh, there's more than one? Okay.
Which you, if you look on bylaws,
Okay.
let me get to the page. Let me get a little out of order here. Where'd it go? Over here. What we're going to discuss is I am sorry, I have not got it.
Are we still in bylaws?
Yes,
Yes.
Mm-hmm.
And we're looking at what?
I'm trying to find it. Give me a second, I'm sorry. Okay, here we are. We are going to discuss Article 3, membership and terms of office. Item F.
All members shall serve without compensation.
Okay. Last fall, I'll give you a little background on this. Last fall, during the evaluation of Melissa, the Personnel Committee had discussion. I offered some input to the committee. Having observed over several years, I think Cindy will back me on this, the revolving door of members coming on and off the committee. And if you think about it, a person in the public gets the opportunity to come to the Board of Health. Hey, you want to be on the Board of Health? And you know, oh yeah. Well, I can get I got some ideas about good health, and I'd like my opinion counted. And yeah, sure. I'm all excited. I want to join that Board of Health. And you get here and you have some ideas, and some of them are shared. But you quickly learn that the majority of the work of the Board of the Health isn't really about your ideas. It's about approving expenditures, ordinances, rate fees, programs, critiquing programs and such. And it becomes, I don't want to say it becomes a burden, because that's what we do, it's our job. But you lose the excitement of being here. And so therefore, many people, when the first opportunity presents themselves, whoop, they're gone. they leave the board. And if you think about it, over the last 5-6 years, how often have we had a full board? It just doesn't happen. So one of the things that we discussed in Personnel Committee was under the Constitution and bylaws, the county is not permitted to compensate us in any form, but they can reimburse us for expenses. And so we had set a goal for Melissa to review this topic and see if there could be like a flat stipend to cover for the use of your telephone and your laptop computer, and for you to buy some clothes or fuel for your car or whatever, some reimbursement expenses. And so that's where she began. And one of the first things that she did was meet with the county administration and reviewed the goal with them. And then they started reviewing the state law, state statute that covers it. And then they started looking at other counties to see what they do for their boards of health. And it came back that if you look at the way Article F, or paragraph F is written, that's basically word for word right out of the state statute when it was originally adopted back decades ago. Well, that law, this language is still in the law, but the law has been amended several times since this was originally inserted by the Board of Health many, many years ago. And so today, the state statute permits the county to offer some financial reward for Board of Health members that participate in meetings and training and conferences, et cetera. So the county, Melissa and I met with the county administration on this topic, and the county was very receptive to the topic. However, they were more interested in following the amended state law with compensation versus getting into a flat stipend for expenses that could be challenged, that, you know, she travels 10 miles, you travel 5 miles, I travel 45 miles, you know, where's the equality and all of that. So at this point in time, the county is waiting for the Board of Health, this committee, and then the full Board of Health to modify our bylaws to permit compensation to Board of Health members. And then the county will take up the topic and set the rates. So Melissa asked for me to put a draft together for the language. And this is There's 3 more.
Just pass them around.
3 more.
We'll share.
And this committee is certainly permitted to put whatever language you want in the bylaws. This was just some wording that I thought would be appropriate and would give the county board their opportunity to act.
Mm-hmm.
I don't see anything there about back pay.
What, 10 years
Plus
worth?
bonus during COVID, right?
Okay, I'm on the Parks Board. I get paid, I don't even know, $50? It means nothing to me, and I do it because I really enjoy it. I don't think a small compensation is gonna make someone stay on the board, if that was your intent. I really don't think, I mean, this is nice, I don't think I'll ever ask for anything, but I don't think it's gonna help with retention, honestly.
Okay.
That's my personal opinion.
Food.
Food, yeah. Food. So,
I'm serious, I mean.
yeah.
And again, the rate will be established by the county. I do have here, the state statute limits what a county can pay its board members. Oh, this is going to be awkward. And I'm not suggesting this at all. It's up to them to make their decision, how they feel fit.
15,000 or something?
No. I don't think it's not, I guess it's more than $50, I guess.
Under 55 Illinois compiled statutes, section 5/5-25012, several paragraphs down, the county board in counties with a population of more than 100,000 but less than 3 million inhabitants and contiguous to any county with a metropolitan area with more than 1 million, which McHenry County is, inhabitants, may establish compensation for Board of Health as remuneration for their services as members of the Board of Health. Monthly compensation shall not exceed $200, except in the case of the president of the board, whose monthly compensation shall not exceed $400.
Oh, I want back pay.
I'm just identifying that to you so that you understand as you decide this issue, what the maximums are. And for the record, I am not indicating what the county board should do for their rates.
But they'll read that, obviously.
Yeah.
I'm sure they know about it.
So it would be us like putting in for reimbursement. It's not like an automatic thing.
No, this would be an automatic thing.
This would be, it'd be an automatic thing.
And taxes come out and.
Oh, yeah, I know,
all that.
it's my $50 is $5.
Right.
Yeah,
Together.
It's reportable income.
yeah. All right.
My thought is that it will help.
Mhm. Oh, yeah.
It will help
$200 might help.
increase in
Yeah.
attendance. One of the conversations that we did have on this topic was we didn't want to rate so high that people would just be on the board for the
To
money.
get the money.
And really not be involved or participate or anything, just come to the meeting and collect the
Well,
money.
we're gonna make the stipulation that you have to attend the meeting to get the $200
Yeah, oh
for the
yeah,
month.
it's for attendance.
Attendance, okay, a month.
Oh.
Well, whatever the county decides,
Whatever
they may
the
say
county-
$50.
Yeah.
Right,
Yeah.
it's up to the county.
All right. All right, do we have to have that on here? About, should that be on there, what you're saying, like, that only 2 meetings attended? Or is that like, a given? That, you didn't show up for work, you don't get paid? Like you didn't.
Can you take it, to make it clearer to the board, you wanna just take it off the state one and leave it at that?
The state one.
The language that I proposed was using the state language.
But they were pretty narrow in their comments, so you could use, my concern is that if the state doesn't say, committee meetings and all that stuff, then I would just leave that off. And because it's just gonna be a flat fee, is what they're saying. So if you're part of the board, you get the fee. I think it's an understanding that with the attendance being a stipulation, but I think to say expound on it any further would be opening up a can of worms for the county to put more crap on there.
Oh, okay.
Do you know what I'm saying? To
Yeah.
put more definition to the attendance part of it, which is really what they're saying in the state level is the attendance, to come to the meetings, you get paid a stipend, right?
Well, I think you are supposed to be attending the meetings in the bylaws. If you
Right.
miss 3 unattended, I think, meetings,
You
you can be removed.
Yeah, we never did that. We had a lot of people that missed more than 3.
Hopefully, maybe this will help.
Yeah.
Thank you for all of the work that you are both doing for any sort of compensation or like value of time. I appreciate that. I agree. I'm here because I want to be here and feel like there's impact. Lupe and I were just having like a quiet conversation, but I'm not gonna come or not come for $200. I'm not gonna stay on the board or not stay on the board because of $200. But we work for nonprofits, so. Like we were talking about like the feel of the impact, like in a project that we help put forth and watch happen, or like chatting with staff, or speaking at the school nurse symposium. Like those things provide more of a value to me than $200.
Yeah, I mean, like I said, it's nice, because if you think about it, okay, well, the gas or whatever that comes to it, but with retention, or going back to your comment of, we're not making decisions that are, that we see as like why we joined the board, but I think the relationships that are built within here, or with, interacting with staff and being like, oh, like, that really helped me, or seeing the great work that they're doing, or continuing to build a relationship with county board, like that probably doesn't compare to the value that we'll get through that, right? Like, we've been saying like an annual event. Like, so if you had me pick between this and an annual event where all of us would be at networking, I would pick the annual event. But I don't know if it's one or the other. Could we have both? That'd be great.
Well, in the past, during one of my interviews for the board, I raised that issue that members of the Board of Health do not receive any recognition for their service to the community. There's no countywide social get-together where we can say, shake your hand and say thank you for coming. There is no annual award ceremony or anything that we participate in that would give the citizens and the staff and administration a way of saying thank you. So I did bring this up, and it did start something, but it fizzled out.
Well, I don't think anybody on the Board of Health knows who we are anyway, and the county board knows who we are.
They're learning.
There's a few.
They're learning.
Yeah.
But,
I mean,
no, I don't mean the board as a whole, but I mean, I don't think they say, oh, Cecilia, how are you doing? How's the Board of Health going?
Right, yeah, exactly, yeah.
So I just wanted to share that with you. That I personally, when I was being interviewed for reappointment several years ago, that was when they asked me, what's the one thing that you want to get accomplished? Well, I want the board to receive some gratitude for their services. They said, well, like how? And I said, well, maybe a get together, run a banquet hall, and have a social gathering. Let us meet the people from the mental health board, from the county board, all together, and so we can put a name to a face, and they could know who we were. But we can't do that. Someone else has to.
Well, I think Melissa and I were talking a little bit about this. I'm used to being on boards that are not supported by like local government or part of local government, and so it's our job to put on fundraisers and find sponsorships and donors. And when you do that, you have these social gatherings where people are there and you give an award and you meet everyone and you get to talk to people. But we were just saying something like I was trying to see what differentiates the mental health board. And I feel like they have a town hall and they invite people to come and they invite people to talk about like what gaps do you think there are? What do you think is needed? What do you think is working well? And it's an opportunity for the community, even with just the marketing, to put a face with like their involvement in things. And then they're at like health fairs and things like that, but the health department does all of those things instead of the board members. And I'm not saying that like it should be either or, but I'm sort of thinking about how like we're kind of the same as the mental health board, but how are they more visible and part of the community? I don't know, Leo just won like 1 million awards. She's great. Leo, you're great if you're listening to this, but Melissa is also great. Like she could be winning awards as well, you know, like, I don't know. So how do we become more visible? And I think we're talking about different things. You were originally talking about appreciation. I think we're talking about like engagement with the community, but I think that those kind of go hand in hand because again, I don't need an award, but hearing from a person who lives here and then doing something that is a direct impact from what they're sharing feels like an award. Although like an award would be fun, but
An event like where somebody's gonna get an award or where we shine all the great work that has been done from the Board of Health.
Instead of like the chambers hold their mixers, maybe we hold a mixer and invite.
Well, there is a difference in that we are a public entity. So we are more governed as to what we can and cannot do.
No, I'm saying a mixer within the departments, like have a mixer of invite the mental health, invite, one of the other. Is that not what you're thinking?
Again, yes, but that's, we shouldn't have to organize a get-together
For ourselves?
for ourselves.
I know. But what does the
Yeah.
We're not gonna do
county,
it.
well, so what does the county board do? I've never been on the county board, so do they have a get-together? How do they do that, and why don't we ask them to invite us to their get-together? And we'll start that way, and then next time we host one.
Yeah.
I don't think they,
They don't
it's,
do
it's
one
a
either?
public meeting, right?
Yeah.
So you have a quorum, you have to, post for a public meeting. I'm trying to think of, I know when they did strategic planning, they met off-site as a group, but it was posted as a public meeting, and some of the department heads were there. I honestly don't know if there are other, if you follow them on like LinkedIn, there are various events that board members attend and are either honored or honoring others, but I'm not aware of anything where they're bringing all
Everybody together.
serving boards together in a ceremony or some kind of event that is honoring.
And even that, I think, would be like a fundraiser to make money for someone running for the board, if there was like an event.
But even that, I think anytime, if you're serving, yes, so there's probably, whatever, political party you're in, I'm sure, there are events that are hosted, for example, where there would be multiple county board members in attendance.
Okay. What about then, thinking outside the box here, what about, I don't wanna say that's the right word, but a buddy system. So let's say we pick a county board person that we're gonna present to the Board of Health. The person that's their buddy does the presentation. The person that's coming is just our guest. We talk about them, we tell them what their job is on the county board. People sit there and they meet them. And then that person is responsible for taking their buddy and introducing them to the county board.
I think, I don't see anything wrong with that. I think actually Ms. Althoff, she's not here now, but she has been saying publicly many times, trying to find opportunities for us, for the county board to get to know the department, in particular, the Board of Health better. I think that's why they invited Mr. Clark and I to go and present, and any future opportunities like that is another opportunity for them to know who you all are and then what you do and what we do as.
But I think there's a big difference in, coming from a sales side of things, there's a big difference in between listening to someone tell you about someone or learning about that person.
Or meeting them.
Well, no,
and
but
getting to
about
know them.
learning that person
Yeah.
and you tell the audience about that person. So you've learned about that person, you're not just hearing a presentation that's Cindy
Sure,
looking
sure,
over
sure.
and going, blah, blah, blah.
Yeah. I mean, it's more about, what I hear you saying, more about like building an actual relationship with someone, being more in relation with them than Cindy Gaffney is the,
Right.
XYZ versus.
And they're
you
gonna say,
got to
thank you for
know-
coming to the
Yeah.
meeting next,
And you're saying, this is Melissa, and
Because your
Melissa is-
peers tend to respect, I don't say this terribly correctly, but in a committee, your peers respect you more than possibly an outside person coming in and just doing a presentation. Does that make sense? Like, if a county board member stood up and introduced Cecilia and told about Cecilia's background, all her commitments, it's sincere, it's done their research about what she does, and it's impacted because it's coming from their peer versus Cecilia standing up there saying, hi, I'm Cecilia, I live here, blah, 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 and this is what I do. Thank you very much for having me come to the meeting. And then you walk away and they're like, okay, what's next on the, not that they won't do that, but I mean, I think it's more impactful if you have a sponsor, sort of.
I feel like this has gotten away from us. It's an amazing conversation, and I'm like, would love to brainstorm different ideas. But I thank you for the work that you're doing to ask for compensation. I
accept it.
think we should just go
with that,
let's do that.
Yeah.
And then
We need to get off topic.
continue to brainstorm ideas about how we can build partnerships within local government and help to feel more appreciated and valued in that way as well.
Thank you.
Thanks.
I take it off the topic.
No, we all did, but I think
Thanks for controlling the
we're all
meeting.
jotting down. She's like, God, she spoke. You know what it kind of reminds me of is like an LGMC government day where like everyone involved in local government comes and you like learn about what each other does. Anywho.
Okay, all right.
But yes, do this, great.
Okay, so.
I don't know
we
what the
have to
word
vote on it.
remuneration means, but, I'll thesaurus it later.
Remuneration means paying you for doing something.
Oh, great, well, you can tell I again, I work for a nonprofit, so.
That's right out of the state law.
Great, so great, let's do that.
All right. So do we have a motion to add, so we're adding this, or changing, wait, we're adding this to Article F in Section 3.
Would be amending.
Amending Section F. Do I have a motion?
Yes, I will motion to amend the Section 3F
Changes presented in front of us.
changes presented in front of us.
And I second.
All right. All in favor? What? Any discussion? What?
Being that it's a amendment to a bylaw,
Oh, money.
and this involves money.
Okay,
You should
so
do a
sorry.
roll call vote. Sorry.
Any more discussion? Okay, roll call, please.
Dr. Katz?
Yes.
Ms. Ortiz?
Yes.
Ms. Clark?
Yes.
Ms. Gaffney? And
Yes.
Ms. Carmen?
Yes. Okay, passes. All right, ordinance passes. Okay, now that we don't need executive session.
We do.
We do. Okay. Okay, all righty. Do I have a motion to go in executive session? Oh, hi.
Do I write this part down?
Yeah, you're gonna start writing, yeah. Do I have a motion to go into executive session?
I'll make a motion to go into executive session.
Okay. Do I have a second?
Yes, I will second.
Okay, all right.
Okay,
And then, okay, and then, all in favor?